Thank you, Chad. Thank you so much. Thank you, Alvin and team, and welcome everyone to this webinar. So as Chad mentioned, in this webinar, we'll be sharing about some of the work that we have done in the last 1 year. And just to provide a little bit of history, why this webinar is particularly important from my perspective, and also for people who funded this initiative. The idea of this entire Navigator came from the AHIN general meeting in 2018 in Colombo, Sri Lanka. So I think a lot of credit goes to AHIN members for raising the issue, and we'll talk more about it. And at the same time, we have been working in the larger digital health space about multiple tools being developed, being used, but difficulty the user faced in navigating the tools in terms of which tool has what purpose, how do I understand them, how do I know when to use which one, and is there any relationship between those tools? So those are challenges that are broadly being discussed during that time. So it took some time, as you can imagine. It takes some time to come together and find resources to address some of the challenging problems. Navigator is one such problem. So in terms of what does the Navigator actually include, and all this content, the detailed slide deck, and other resources are available on the wiki page. We'll share the link in the chat as well. So why is the Navigator needed? As I mentioned, the challenges that were being faced still, there are challenges around assessments, tools, where to find them. So those challenges are addressed. We'll highlight how some of those are being addressed by the Navigator. Why use a maturity model-based assessment? So the tools that are included, and when we say capability models, basically we are referring to maturity model-based tools that are included. They offer a very systematic and many times a quick way of measuring and describing your current capabilities, but also identify the future pathway, the future state where you would like to see your organization, different components of your organization. What tool best fits my goal is what drives the Navigator, which means what is the goal that you are trying to accomplish? What is your assessment goals? And that determines which tool seems to be more appropriate in a given setting, but also how the tools can be used together. So let's say you use the Navigator and it says, the Global Digital Health Index, let's say, for example, is the appropriate tool for you, but you already have conducted a few other assessments. Can you use it? How do you know how to benefit from those assessments? And sometimes assessments are big, large documents. So is there a way to narrow them down? Yes, it's possible. So that's what the Navigator also tries to address. At the same time, we also acknowledge that it was not possible for us to include all the maturity models that were included. So you'll see which ones are included. And what we didn't include here is the system-specific maturity models. We'll highlight what it means. And by system, we are referring to system categories that WHO has identified, whether you can have lab, EMR, workforce, those maturity models, they are not included in depth in mapping with the national level tools that you've included. But we have provided one example. We included supply chain information systems maturity model as an example for system specific, that how it's important for us to understand how these system specific models fit into the larger national landscape. So we've taken an example into the Navigator. You can find it in the user guide that explains how that was done. So those tools are specific, address the specific needs, but they're part of the holistic, overall need. Okay. So this is just a brief overview. Now, what is the value? Why was the Navigator needed? So as I mentioned, it serves a useful purpose. One of the benefits of these tools is that you can look at what the current capability are once you conduct an assessment, but you can also see how would the life of an organization look like if they make progress, if they move forward. Can they visualize it? Can they imagine it? Yes. When you look at these tools, you will be able to see, and what they will describe it as maturity levels or stages of progress. You'll see at 1, 2, 3, 4, 5. So they're not just numbers, but you'll see the characteristics that your organization, in terms of your policy, the workforce that you have, the infrastructure that you have, how it will look like if I'm at level 3. And by those characteristics, you can also assess what are the functions we can perform as of today, looking at what capacity we have. So it's an important distinction. It allows you to see what is that we can do today and what we may need to build to achieve our future goals. And given that there are a number of publicly available tools, it creates problem to really identify, which one should use. Now, each tool has its own unique value, and they're aligned to specific goals. And the Navigator does it. It builds on the individual value of this tool. So if you look at one individual tool, we'll share that, summary of those tools. They're all valuable. But at the same time, if you want to understand, okay, I have 5 and all seem good. How do I figure it out? One that is appropriate for me. So one way to go about is you look at all the 5, go in detail, and then make your decision. The other way is you look at the Navigator and it will go through some of the same steps, but relatively more organized in a systematic way, and you might be able to make the decision quickly. So for clarity, Navigator is not another maturity model-based tool. It's not a mega tool. What it says is if you have 6 tools, the one that are included here, and you have a question, which one is appropriate for me? And what are the criteria I should use? That's when you use the Navigator. So Navigator will not help you assess your capacity, but it will help you to know which tool might be appropriate for you to conduct that assessment. So what is exactly the Navigator? There are 3 pieces, 3 artifacts that are included. One is user guide that expands on this slide deck. This slide deck is a summary. There's a larger slide deck that is available on the wiki page. Then there is a decision support workbook that we will be presenting as a demonstration that how you can use, how it works. And if everything goes well, we also have our conversation with one of our partners to help implement in 2 countries. So we will have more documented information about how that experience was. And the slide deck. So I mentioned slide deck, this is a summary, but the detailed one is available on the wiki page. This Navigator also complements the World Health Organization Digital Implementation Investment Guide. So if you look at the investment guide, there are certain process steps that they have recommended. One of the steps is the review process. And there it recommends some of the tools that you can use at that stage. And by following that approach, Navigator provides guidance on individual tools, what their summary of the tools in terms of their process, the methodology they use, where they have been used, their web link, but also providing information about how can you use these tools in combination. Now, as I mentioned, why do you use maturity model tools? You can know what current capacity you have. And when we say that, basically we are talking about human resource or workforce, your business processes, your technology, and organizational capabilities, which includes leadership, governance, policy, your vision, financing. Those aspects go into those aspects. So you can look at the current capabilities, but you can also look at where do we go from here? Let's say we look at 2021 and we want to find out what happens in next 1 year, what happens in next 3 years, where we'd like to go. And those goals in terms of maturity or progression are determined in relation to your larger organizational goals. So if you want to, let's say in HIV, they'll say if you want to achieve our 95 goals, that's the program goals that determine what capability are we looking at. So maturity is not for the sake of maturity because it looks great if you're level 5, because we can tell everyone that our organization is maturity level 5. It has a cost. It takes time. It's resource intensive. So what level we will accomplish for technology, for processes, for workforce, these are all guided by what is the organizational goal that we want to accomplish. So it's always important to keep in mind that that goal is very, very important for us to determine what is the level we should try to achieve. And it uses ability to set goals for future levels of maturity. So that's how the goals are related. And if you are able to identify your current capabilities, also where you would like to go in 6 months, 1 year, 2 years, it helps develop an improvement plan. And that guides your entire implementation progress, and you can use it to monitor as well. So why use a maturity model tool? We have already talked about that. And it helps to identify strength, but also helps to identify the gaps that you need to overcome, to achieve your future organizational goals. So how was the Navigator developed? Well, we followed a very comprehensive process. And again, we said that whole idea started with a meeting. And we started deliberating. And the one thing at the same time we were talking, and the AHIN general meeting provided some kind of push for that initiative, was the one thing we did way back in 2018, late 2018 and early 2019, was we published a summary of 6 key tools that is still available on the Measure Evaluation website. We call it Digital Health Resources Summary. It included 6. Many of those tools are included in the Navigator here. And that summary was, what is the tool? What's its purpose? What is the methodology? Who developed it and who funded it? That's just a brief summary of 1 or 2 pages. So that was there, but late last year, we started this conversation on Navigator. So once we had additional resources, we looked at all the publicly available tools. Now, one of the important criteria for us was what is available in the public domain. Now, because we need to access this for this purpose. There are other great tools available. Probably you are aware of some of them, but because we didn't access it when we were working on this, they are not here. There's no other reason. It's not that they're not good tools. They're all good tools, but we couldn't include it. We talked with people who were involved in development, people who used it, implemented it at the country level. We also established an advisory group, which included, representatives from the USAID, the WHO, World Bank, UNICEF, Catty Collective as a group that has done some work funded by the Gates Foundation, and also the USAID Chizu project was part of it, where AHIN is also a member in that project. So with all those groups working together, and another very important group which has been leading this process is the Maturity Model Small Working Group. And if you're not aware, this group is part of the Digital Health and Interoperability Working Group of the Health Data Collaborative. So that group has been spearheading this initiative for quite some time. So all those conversations led to identifying which tools needs to be included. We talked more about it. We implemented, we piloted, and we piloted in 2 phases. The first phase was just about testing, are the goals that are determining, helping users to identify appropriate tool, are they relevant? Are they appropriate? Do the users relate to that? And we refined it, we updated it, and conducted a second pilot. And the second phase was focused on, okay, I know what goals are, but what if I conducted assessments in the past? I conducted 3 assessments. Can I use those findings? So that component was added in phase 2, and we tested it again. And after all that, the revised version, revised materials is available in the public domain, and we are in the process of sharing and socializing it with the larger community. So which tools are included? You can see the names here. The early stage digital health investment tool. This was funded by the Gates Foundation, Global Digital Health Index, that many of you are familiar. HIS Interoperability Maturity Model, HIS Stages of Continuous Improvement, the Information Systems for Health. This is something that was done by the Pan American Health Organization, PAHO, and the WHO SCORE Essential Interventions. Now, the WHO SCORE package has a number of tools included in the package. So we're not talking about those tools. We're talking about the Essential Intervention document, which describes how survey count, optimize, review, and enable capabilities are improving, how they're being measured, and it's similar to maturity framework. So that's the one that is included here. So the tool selection parameters, how did we decide which maturity models to include here in the Navigator? 1, focus on the national capabilities and not any system, not supply chain in particular, not EMR. Now, you may ask question, what you said, not supply chain, but then why include supply chain? Because there was another group working with the maturity model, small working with the same time on updating their supply chain information system maturity model as part of the larger global supply chain project. So that was an opportunity for us that while another group is working on it, can we bring them together and showcase as an example of how system level maturity models can also be connected and linked with the national one. So just to provide an example, we work with that group. We included tools that are agnostic to disease. They're not about any particular disease, HIV, TB, malaria. They're more about national capabilities, whether it's information system or digital health, implemented by Ministry of Health in low and middle income countries, and available and accessible for the purpose of alignment. So those are the key criteria that were used to select. Community health information system are another key area. There has been a lot of conversation. So hopefully you'll see more work in the future, whether we will do it or some other groups, but that's another area to for users that they're facing challenges with. And system specific maturity models, as I mentioned, they're specific to particular system. They can be used in combination with the Navigator. Supply chain was just an example, but we also included a few other domain-specific maturity models description, not in detail. For example, AI for Health maturity model developed by the Novartis Foundation. We have briefly explained how Navigator aligns or can contribute to them. There's a disaster preparedness digital tool from the ZIZ with the Digital Square project. So we have included a brief description. There is another initiative by USAID. It's called Digital Ecosystem Assessment. It's not a maturity model-based assessment. It looks in the entire digital ecosystem going beyond health of a country. So it follows a mixed method approach, but we also provide a description how Navigator can help there. So we had a conversation with that group, and if a country wants to go deeper into health, Navigator will be very relevant for them. So system categories here is what WHO defines system categories, and you can look at into digital implementation investment guide. I mentioned some of them. Terminology is another system specific. So we are working with that group to see how Navigator can contribute to their work on the maturity model. We'll be sharing with them with OpenHIE community on the terminology management in early January. So this is just to explain that, yes, there are system specific models. There is a way to connect, and users will definitely benefit from having understanding of a holistic way of looking at all the different tools. But by that, I don't mean that there will be one tool which will do everything. It's just understanding the relationship between these tools. So the Navigator asks, what tool best fits my goal? Each tool is designed to serve a specific purpose. It's very important that we know what they're going to help with. The Excel-based decision support book, the one that will demo my colleague Liz Millar will present it, it helps to select, and it will ask you which goals is your priority. And then it also aligns with your audience, available resources, and the priorities, digital health areas that you would like to assess. And it provides guidance on how can you combine findings from the past assessment before moving forward. Now, by combining, we don't mean that it says you must do this. It just recommends some of the similar looking indicators for you to review. And because all the tools are designed, their architecture is different, it's very important for us to understand what is that we are being mapping. So we'll again talk about that. And there's a detailed mapping of indicators. So if you don't want to do anything, you can just look at the indicator tab or the Excel sheet, which has all the indicators that are included in the Navigator and how they align with one another, the 6 of the tools that are included. So these are the main criteria, the main goals included in the decision support workbook. These are the 9. And generally, the workbook recommends that you select 1 or 2 goals. There is no tool that is in this Navigator that can do 3 different things. Now you can select, you'll try, but the Navigator will give you a message that there's no such tool that exists. So you will focus on 1 or 2. And if you want to know, okay, can I get a summary of those tools before I go into the Navigator? Yes, there are individual tabs that you will see summarizes each tool just to get you a summary. And that will also give you an idea which one can do what. Previous assessment. So once you select your main goal, it will ask you to select, have you conducted any assessment in the past 2 years? And 2 years is what we were recommended to include, because we also understand, especially in the country health system, especially in the government, it takes time to implement. And we also need to provide some time for the implementation to show results. So that's the time frame that comes from. So it will, once you select your goal, past assessments, and you move forward, you will see, okay, what is the appropriate tool and how do I use past findings? Now, it's also possible that when you select a goal, there is more than one tool that can serve that purpose. So there are additional criteria like language, methods, methods relate to your resources that you have and what areas you would like to, focus on. Leadership, data use, that will also help in further narrowing down which tool is the best fit for option that you are looking at. So the decision support workbook, again, I said, choose 1 or 2 goals, select previous assessment, and if prompted, select additional criteria in case there are 2 tools for the same purpose. And then it will highlight which tool is appropriate for you. It will also highlight the indicators that look similar, and it will recommend, please review it more closely before you move forward. So in summary, we're hoping the Navigator will help users to select one of these tools based on their purpose. The decision support workbook is the interactive part of it. User guide provides more detail about why these kind of tools are used, what are some of the other initiatives. And Navigator is a good resource to use prior to conducting any assessment. Now, if There are tools outside the 6, of course, you'll have to look at it. But if the tools come from this, these are the 6 global, well-developed and widely used tools. You can look at it and then you can make a decision. Okay, do we really need to conduct a new assessment? And if yes, how are these findings helping us inform our planning? And we already have users from Nigeria, from Ethiopia, who are interested in trying to do. We may also have opportunity in Indonesia, where some of our partners may like to do it, also in Kenya. So you can see there's a lot of interest, and we're hoping that will inform our future experience in further improving. So that's all from my presentation, and I can hand it over to my colleague Liz Millar, so that we can see how that Excel decision support workbook works. Thank you, and we will have time for questions, definitely.
Thank you, Manish. And hi, everybody. Good evening, good morning. As Manish said, I'm going to do a demonstration of the interactive portion of the Navigator. So this is the Excel-based workbook. That's one of the 4 components of the Navigator that Manish went through. And let's start with just a broad overview before we get to the interactive portion, which is in the tool selection tab. But this is the overview tab for the Navigator. So here you can find the link to all of the pieces of the tool, all of the components, some details about the purpose of the workbook, who should use this workbook, and how can these results be used. And then you'll see a link here saying, take me to the instructions tab. That's because we recommend you go through all of the tabs before you jump into that tool selection. So here is a section of instructions for the workbook. So a step-by-step set of instructions that take you through how to use the tool selection tab. A key piece here is to make sure if you've downloaded the tool and maybe you're following along with me, or you do this at a later time, you want to make sure that you enable the content. Most of the time when you download this stuff from the website and save it, there's a ribbon across the top, a yellow ribbon with a button asking you to enable the content if you'd like the macros to run. So you need to make sure you do that for the workbook to work as intended. And you'll also need to save this Excel file to your computer before entering data. We'll go to this tool selection. We'll come back to that in just a minute, and I will go through all these steps here. But I just want to draw your attention to the other tabs that are included in the Navigator workbook. There's a description of each of the 6 tools that are included, the abbreviations that we're using in other parts of the workbook, so you can refer to that. Each tool also has its own individual tab with a link to that tool, who created it, an overview, the specific goals, as Manish was talking through. We use these tools as prescribed by, the goals as prescribed by each of the assessment tools to map what their intended purpose was. And I'll show you that in the tool selection in just a minute. And there are also a list of client countries, so you can find information about where this tool has been used or how it's been adapted as is. So there's a tab for each of the 6 tools. And then I wanted to make sure I showed you, there are a number of tabs in this workbook, and depending on sort of how big your screen is or how far you have it zoomed in, you may need to toggle over to get to all of the tabs. So you can see I've toggled over to find all 6 of the tool tabs. And then there is also a tab about indicator mapping. We'll talk about that in just a moment. Manish touched on this briefly, but that is a one-to-one mapping that we did of all of the indicators from tool to tool. So one tool to one tool to look at a comparison of their indicators. And I'll show you an example of that in just a minute. So I'm going to go back to the tool selection tab that we skipped over the first time. And this tab provides suggestions of which tools best fit your goals in conducting an assessment. So what you do as a user, you would want to begin with the question, what are the main goals or goal of conducting an assessment? So you can see here that you may select up to 2 goals. So we recommend 1 or 2 goals. There might be a number of these that you're hoping to accomplish, or you'd like to use the results of an assessment for. But in order for this interactive workbook to make a suggestion, about what the best for fit tool is, we recommend that the user or a group of users really think about what's the main goal in conducting an assessment. What do I really want to accomplish? So that might be to develop a digital health or e-health strategy. I might be interested in some of these other aspects as well, but I know that my main goal here is to conduct a digital health or e-health strategy. And again, you can, and so these light up red to let you know which ones you've selected. You can select up to 2, as we said. If you select more than 2, it'll ask you to please reduce your choices. And then the second question here, have you used any of these tools in the past? So the 6 tools included in the Navigator, we want to know, or the tool wants to know, in this context, in this setting, have any of these tools been used? So in this case, I'm going to select none. So none of these tools have been used previously. And I know that my goal for my country or my organization is to develop a digital health or e-health strategy. So once I've selected those options, I can choose process here. I'll also just point out, if you scroll down a little further, as I have to on my screen, there's buttons for process, reset, and then also to save and close. So let's go ahead and process this selection. And we can see this little pop-up box here. The goals you selected returned 2 or more tools. Please select additional criteria below to identify which tool is the best fit. And this will tell me more information if I look at the table that has been populated here. So based on the goals that I selected, the tools that best fit my goals are GDHI, the Global Digital Health Index, and EDIT, or the Early Stage Digital Investment Toolkit. So that's based on the fact that I selected digital health or e-health strategy as my main goal. And there are some additional questions that have popped up here to help me narrow down my choices between these 2 tools that have been suggested. So there are 3 additional questions that have popped up. In what language will the assessment be conducted? That might be a key thing if you need this assessment to be available in a specific language. These are a list of the languages that any of the tools are available in. So English, French, Spanish, Portuguese, and Arabic. So maybe I really need a tool to be able to use with my stakeholders that's available in Arabic. So I can select that. There are 2 more questions. Now you need to select a response for at least one of these, but you do not have to select additional criteria in each of these categories. So the 2 other questions, what assessment methods do available resources support? So that really has to do with, can you do a big 2 to 3 day consensus building workshop with stakeholders, a week-long workshop perhaps that includes site visits and observations? Or do I really only have enough resources to do a half-day workshop with a few key stakeholders, say without maybe bringing people in from different locations, that sort of thing. So you might select one of those options depending on what your resources make available. If resources could support any of these, then I would suggest that you leave these unchecked and not narrow it down by that. And then which building blocks are your priority to assess? So these are based on the WHO ITU National eHealth Strategy building blocks. And they're laid out here. I would say, I think each of these tools, each of these 6 tools includes indicators around leadership and governance. So that may not narrow down your selection any further. But for example, data quality and use, there are only 1 or 2 tools that really get into that in detail. So if you knew that data quality and use was something you wanted to assess your capability to be able to do in the context, then you would want to select that. In my case, I'm just going to select 1 additional criteria. I'm going to say I need this tool to be available to me in Arabic. Oops, I scrolled too far. And then I'll scroll back down to the bottom and I will select process here. And you can see, based on your additional selected criteria, the most appropriate tool in the Navigator is the Global Digital Health Index, and that's because it's available in Arabic. So please select that tab for GDHI down here for more information about this tool. And again, this will give you a link to that tool, a little more information about it, what they say their goal is, where it has been used, client countries, and links to those as well. So I'm going to go back to the tool selection tab. I did want to point out that had I selected a criteria, an additional criteria that applied to both of these tools that were in the running, maybe English, English, both of these tools are available in English, it would have just returned to me the same result, that there are two tools that meet my goals, and that the tool would suggest, or excuse me, the workbook would suggest that I look at each of those tools more closely to make a determination about which of those two is the best for fit for me. So now I'm going to run one more example using this interactive portion of the workbook. So I'm going to scroll down to the bottom and click reset. I pointed this out earlier, but if you were to select save and close here, that would save a version of the workbook with this recommended output. Be sure to give that a unique name, but if you wanted to say save the tool that it recommended and how you got there, you could save a version of that using this button. So I'm going to reset and go back to the beginning. My main two questions here. And this time I'm going to say, what is my goal in conducting an assessment? Okay, I know that the goal is, or my goal in this context is to assess and improve HIS interoperability maturity. So maybe I'm really interested in interoperability maturity. So I'll select that option. And then I'm going to see, have I used any of these tools in the past 2 years? Well, yes, I've used the Global Digital Health Index, and I've used the HIS stages of continuous improvement. So I know that those assessment tools have both been used in this context. So I'll go ahead and select process, and you can see there's one tool that fits my goal. So the tool that best fits the selected goal is the interoperability maturity model, or the IMM, based on my selected goal to assess and improve HIS interoperability maturity. And it's telling me, I've got this little pop-up box saying, look at Rev Tabs for additional information on previous tools used. Okay, so where are those Rev Tabs? Well, remember, if you remember back in the beginning, I told you you may have to scroll over, toggle through to get to additional tabs. And actually what has happened is, based on the tools that I indicated I have used previously, the workbook has auto-populated some additional tabs with indicator mapping. So what these are a mapping of, let me select one, a mapping of the tool that it's recommending to me. So based on my main assessment goal and additional criteria, if used, the HIS interoperability maturity model is the recommended tool for me. But given that I've used the Global Digital Health Index in the past, Navigator recommends reviewing the data and following indicators from the GDHI assessment to determine its relevance and applicability to my main assessment goal, and to inform a new or planned IMM assessment. So what this is a mapping of indicators, individual indicators from the Interoperability Maturity Assessment Toolkit and the Global Digital Health Index to show me where specific indicators have overlap, where they align, where I might be able to draw from previous assessment results to inform a new assessment, and also to understand how much overlap there is between these two tools. So I'd want to take a good look at that to really understand, okay, well, here's how Interoperability Maturity Model measures governance structure. Here's their definition and how they measure it. And that aligns with the GDHI's indicator 1, digital health prioritized at the national level. So I would look at those to see, well, how closely do they align? It doesn't necessarily mean that they're measuring the same thing or measuring it in the same way, but this allows the user to be able to compare how each tool is measuring these differently, and to understand what added value there might be in using the interoperability maturity model and looking at some of these indicators that have already been measured. The additional tab is a one-to-one mapping for the other tool that I've indicated that I have used in this setting. So that's interoperability maturity model to SOCI, the stages of continuous improvement toolkit. And we can see here, these tools have indicators that are very closely aligned because they were developed with inputs from many of the same groups. So it's not surprising that there's some comparisons that are similar among these tools, but not everything. So I'd want to have a good look at this again and see, well, what results can I pull from SOCI to inform a new assessment, and how much overlap is there, or where are they measuring the same thing and where does it differ? There is an Excel-based appendix that's on the Navigator's main website where all of these one-to-one mappings are available. So there's 20 some different tabs between all of these 6 different tools, showing the indicators between each of those. And some of them have many that have a bit of overlap or at least have a relationship that you'd want to look at. And some of them one-to-one tool comparisons only have 2 or 3. Okay, so I'll go back to the tool selection tab. Once again, you can save and close this if you wanted to save that output, and those red tabs would stay as well. Or you could reset it and start over and select some new criteria. I did want to show briefly what would happen if I selected multiple assessment goals. Again, we mentioned that you can only select up to 2 for how this workbook works. And maybe I have used one of these tools in the past. So if I select process, the Navigator will remind me there is no tool in the Navigator that aligns with the goals you have chosen. Please select fewer goals and try again. So let's unselect one of those and I'll say, okay, my goal is to assess and monitor digital health readiness to prioritize digital health investments and to track, monitor, assess, and benchmark the effective use of digital health. So maybe I know both of those are of equal importance to me. So I'm going to process. And once again, it's going to tell me there's no tool in the Navigator that aligns with the goals you have chosen. So what that's telling me is that there's no tool in the Navigator that fits both of those goals. So there might be a Navigator that there might be 2 tools that would fit each of those goals independently, but there's no tool that sort of equally serves both of those goals. So what we recommend you do if you really are interested in both of those goals is to just do them one at a time so you can really understand which tool aligns better with which of those goals. And then you can do a comparison of, say, edit versus a different tool. Okay, I'm going to stop there and hand it back over to Manish. Thanks very much.
Thank you, Liz. And I do see there are questions. Alvin, to your question, the Navigator helps to find the appropriate tool, but if there's a tool in the country people are already using, whether it's government or any hospital system, it won't flag the gap in the tool that you're using because that's not the purpose of the Navigator. And the Navigator can be used by any organization. The Navigator is not meant only for governments. It's meant for anyone who is planning a digital health investment, who wants to assess the capacity and would like to know how the organization is currently doing and what the future improvements are going to look like. They can use the Navigator to identify which tools. They can also look at the summary of each of the tool before going into the detail, because summary does gives a good idea about how those tools perform. So I would say that those are the things it can really help with. So it's not only meant for government, anyone who is working in this domain can use it.
Thanks, Manish. So the tool is like a navigator that based on the answers that you give in the first few tabs of the spreadsheet, points you to the proper direction on what tool you can use, and then you can then get the tool and then you follow the instructions of the tool. My first question was about if a country was already using a digital health application, not a tool, sorry.
Okay.
They have a digital health application, let's call it electronic claims, and it's working. Hospitals are submitting claims. There are challenges. So there are areas for improvement, but we can't pin down what areas this would be. Would you think the Navigator would be appropriate, like first diagnostic, we gather a group of stakeholders around the e-claim system, and then they go through the tool together, select the options? Would that be a proper process for selecting the tool? Because I would be more comfortable having a group of people from different perspectives looking at the tool, at the Navigator, and then by consensus, fill up the Navigator and then end up with the tool and then finally they all have ownership and they know the provenance of why are we using this tool. It's not because Alvin said we should use this tool or Manish said we should use this tool, but rather there was a workshop. We gathered people from the hospital who filed claims, patient groups, dialysis centers, from the insurers, from the health individual health providers, the institutional health providers, and then in one room we go through the navigator, and then the navigator will guide us by asking a series of questions, and then we argue amongst ourselves what might be the top two reasons. I think the first question was like, what are your objectives, and choose only two. And maybe it's like a real-time group work, and then at the end of the navigator will end up with the right tool, and then that's the tool that we will then use to go on a deep dive on and apply it to our situation. Is that a proper way to use the navigator, Manish? Over.
Well, I'll say yes, that's the most appropriate way to use not only Navigator, but any assessment tool that you finally identify. So what Navigator can do is, if where it becomes very handy as a navigator is, let's say I go to a policymaker, the top leadership of the organization, and I need to explain to them that we need to conduct an assessment, and it's important for us to start. But there are many tools, and here is how we can start identifying. So for leadership, it's quicker, just a few minutes, and they can get an idea. Okay, I understand there are multiple tools. I understand, but again, just for them to get an idea is one. But bringing a group together that is finally going to execute it, take the findings, they need to buy in that, yes, we agree this was the appropriate tool before we conduct the assessment, is always recommended. So that's why we say, leadership, yes, but the people who are going to implement and plan, they need to be part of that. They also need to know, how did you identify this was the right tool? So I think, Alvin, what you're pointing is the appropriate way to go forward. The e-claims, if I understand it correctly, e-claims will qualify as a very system category, tool or application. So you like to go into the claims. Now it fits into the National Digital Health Ecosystem and National Health Information System, but it's not the National Health Information System. So most of these tools that are included in the Navigator, they're targeted the entire National Health Information System, not to any particular one. But I can still say from my own personal experience that there are a few tools that can give you a good insight into, okay, what might be at a higher level missing in our work in claims that we need to prioritize. Maybe it's not related to e-claim system. It is something else that is part of the larger HIS ecosystem. So we have to see whether the claims team need to focus on it, or we need to engage others and get their help to address, because it's not in our scope, it's not in our budget, it's not in our team's mandate, but it's affecting us. So there are tools that can point you towards, and that can definitely help the overall e-claims work.
That gives me an idea of something we can do, right after the call, maybe, Manish, if we can get some interested. I mean, the Philippines is not just the one with the national insurance scheme. Yep. Indonesia has one, and then India has a federated insurance system, right?
Yes.
I think Vietnam is going. Vietnam and Laos are also going on national single payer. So I think that the Navigator is a very useful tool. I think the method or the process by which we get the group of people who will use the Navigator and then end up with the tool based on what the Navigator suggests, be very powerful and influential, because just selecting the tool is already, as we said in Colombo in 2018, there's just too many tools and people are confused which one to use. So if you get the right people, the right stakeholders, use the Navigator as a selection tool, and then end up with the right tool, and then that's the time we contact the tool developers, right? And ask for the next step. So I saw that some tools are not on your list. What will happen to those tools, Manish?
That's a great question. This is the question we were asked about community health information system maturity models that are being built, that are available. There are many national ones coming up. What happens to them? One of the questions we were asked is, can we add them to the Navigator? Yes, definitely you can add it to it. Now, who will add it? Who will have the resources to do is the question. Not that technically you cannot add it. Yes, conceptually, follow the steps, work with that group like the group process we described. That's exactly what we followed to create this one. And you can add additional tools. Now there's another conversation happening is, can we make it digital? Can we make it web-based? Because that can reduce a lot of burden and make it more widely accessible. And it will also help in easily updating, additional tools. So those tools can be added. Now, when and how is not something that I know, because one, you'll need funding resources to do that. Then we'll have to work with those groups to include it. And we need to make sure that those tools are available in the public domain. But I can tell you, yes, there is conversation also within the donor community that can we, mobilize some resources, get other tools in this kind of framework? Can we make it a digital? So just conversation has started. And some of my own personal work is around that. Okay, Navigator is great, but it still is a very basic level, right? And the indicators that we have mapped is our manual, it's a manual effort, it's our subjective understanding. There are more rigorous ways to align the indicators. So probably I'm hoping that I'll be able to pursue that one. But again, it's a good beginning and there is a conversation. So again, Alvin, like you said, if insurance systems are a priority and is happening, I think that will be a great example to pick. And it's not only in the Asia region, but everywhere else, people are implementing it. And to see, can we include that kind of tool into the Navigator and align with the national larger digital health HIS ecosystem? I think that will be a great example. So I would say, yes, let's advocate for it and talk with whatever forums we have.
So maybe the Navigator might actually be a network of tools.
Yep.
And it becomes more powerful and influential by attracting more tool developers. And we can devolve the work to the tool developers themselves to tag their tool, like this is appropriate for this strategy, these are the objectives of our tool. So it's like self-tagging, and then so you don't have to do a lot of heavy lifting, but just check whether they're being honest with the way they're tagging their tool, and then that's a way for them to fold into the Navigator, just to keep the costs low. And
that's a great point. Yep.
And to get the tool developers themselves to have ownership as to how they're tagging their tool vis-a-vis the rubrics of the Navigator. That will be, I think, a great next step for the Navigator, Manish, if you'll open up the Navigator that way.
That's wonderful suggestion. And Alvin, I can tell you that in January, we'll be talking with the terminology managed maturity model group, and they are not planning to expand their maturity models. I think that's a good time for us to follow what you just suggested, that they can tag with the Navigator when they're building the tool. The World Bank has developed its own maturity model-based tool. They looked at about 10 or 12 of them. Our colleague Gabriel worked on it. And what they did, and is something that Navigator can add value, is when they looked at other tools, they mapped the indicators from those tools into their tools. So if we look at the World Bank, we'll be able to see which of the indicators were picked up from other tools and where are they. So that's something Navigator also allows you. You can look at all the indicators in the Navigator and you can make a custom tool for yourself. That, okay, these are the indicators that I want to look at it. So let me build my own tool. Of course, you'll have to validate and test it, but at least you are still picking up indicators that were tested, validated in other places. So Navigator, that's another value of Navigator. It allows you to build your custom tool and not just to take a tool that was there. And when you are customizing it, you will be able to say, oh, these indicators came from here. So anyone that uses your customized tool also knows how it fits into the Navigator. So those are the additional value you're hoping that, same like you said, tagging, if people will do that, I think that Navigator's value will even further increase.
And you can now start mix and matching indicators from different tools depending on your objectives and your expectations. And then you can show provenance. I got this from tool A, and then this one from tool B and from tool C, and I give credit to the the sources themselves, and then once they fill it up, they can then feed back the results to the navigator again with empirical data, with actual data, and that it becomes also a source for other countries to say, okay, I don't need to do the mix matching anymore because this country, we like the way this country did the mix matching, and we see the provenance of how they were able to generate their own customized assessment tool. So, Manish, were you able to see the digital health maturity model of WHO? We've heard a lot about it, and we heard that it was supposed to come out soon. Is it in the Navigator, or it didn't make it to the Navigator yet?
So the WHO dynamic digital maturity model is
Dynamic
yet not, the
digital health.
dynamic one is not in the public domain. We have talked with them. Last time when I talked with Samir and his team, they mentioned that, by December, they will have a draft or something to discuss. So,
Okay.
but yeah, no, I will say I haven't seen it, but we have been, working with them to see how Navigator can contribute to their work or how they would like to reference it. So hopefully that will happen. Yeah, Jay, I see your hand raised.
Thanks, Manish. I was just looking at how this, just like how we did SOCI for another workshop in Lover. Like I'm seeing this utility of this navigator for AHIN's Convergence Workshop. So Convergence Workshop could be a very good platform where this could be useful. So for example, AHIN is going to conduct a Convergence Workshop next. Like recently we had in Lao in March, like it's going to be almost a year now. Say we schedule another one. Like how do we actually get to use this? Like will your services be available, or we can do it on our own, or how do we do it? I just joined the meeting a bit late. I was on transit.
No problem. So all the resources are publicly available. Slide deck, the one that summary slide I presented, the largest slide deck is also available on the wiki page. And maybe Liz, please share the link here in the chat. So look at it, Jay, and if you think you and your team can do it, great. But I'm very happy to contribute to your efforts anytime you would like me to do. So it's both ways. Our purpose of making it publicly available, everything, including slide deck, was exactly that people should be able to download, look at it, do on their own. If they have questions, they can reach out to us, or they can come to the maturity model small working group. We'll provide support there. Or you can write to me directly, and I'm happy to help. But yes, see if you want to do yourself or you want to invite. It's up to you to decide.
That's a good idea, Jai.
Thanks,
I mean,
Manish.
yeah, we're scheduled for some convergence workshop, so I think that's a good way to introduce this navigator.
Okay. And I'll be in India next 2 weeks. So if your timing and that time zone works pretty well, if you're planning in those 2 weeks, otherwise, let me know how you would like to proceed, and I'm happy to support.
Yeah, sure,
Okay.
Manish. We'll get in touch.
Thank you, Manish. Thank you, Jai. Thank you, Liz. It's been a interesting 1 hour. There's a new tool that's coming out, a navigator that will help us navigate through the many, many tools. I think we learned that a methodology of having different stakeholders go through the navigator together, answer the questions together, have a debate on what boxes to check, and agreeing to disagree, and finally coming up with a tool selected because of the navigator, which is already an achievement by itself. Because just looking at all the tools available, don't know where to start. So congratulations, Manish and Liz, for at least working through since 2018 trying to solve this problem. Jai and I and Dr. Bunchai will try to craft something on how to give more life to the navigator. It shouldn't be just a tool. It should be a tool that is used, and we need to document when we use it,
Yes.
how it works and how it's not working, and then we just need to keep on improving it. So we have some people from national agencies in the call. Manish, we'll revert back to you on a possible plan to use the navigator at least here.
Okay. Well, thank you, Alvin, and everyone. Yeah, please, when you use, do share your feedback, because that's what we are looking for. It's great to build a decision support workbook, but the real test is when people start using it, are they really finding it useful, or still there are gaps? So thank you so much.
Okay. So thank you, Manish. Thank you, Liz, and to everyone in the call. Good night. Keep in touch and see you in our next 8 hour. Thank you, Cha.
Thank you.
Take care.
Thanks,
Thank you.
everybody.
Bye.
Thank you. Bye bye.